In light of the positive case detected in both Raglan and Hamilton, ministers have agreed today to move these areas into level 3 restrictions alongside Auckland from 11:59 p.m. this evening. I'll now share a bit more specificity around the areas that will be covered by level 3 restrictions. It will include Raglan, then coming from north down south to Kowhata, Huntly, Ngāruawāhia and Hamilton City, based on the Hamilton City boundary. These boundaries will be published online. Just a word about the surrounding boundary areas. In terms of management of the boundary, in this case, Auckland's boundary will remain in place as it stands. For these new Hamilton areas, there will be spot checks around these boundary areas, but it will not be the same as the hard boundary we've been operating for the Auckland outbreak. The reason for that is simply a practical one. The Hamilton area simply has too many feeder roads for us to successfully operate a hard boundary around the outskirts of the area. So we ask people please to maintain compliance, and there will be spot checks in place. For those who live and work across these areas, we ask that those who can work from home do work from home. We intend at this stage for these level 3 restrictions to apply for the next 5 days. This is the same approach we took when cases emerged in the Upper Hauraki area. It gives us the opportunity to contact trace and widely test in the coming days to assess if the virus has spread widely. If you live in these areas or have visited these areas and are experiencing even mild symptoms, please do get a test. After 5 days of wide testing, contact tracing and wastewater testing, we will assess whether the restrictions need to remain in place. It is noteworthy, however, we have had wastewater testing in the Hamilton area on the 29th and 30th of September. Those have been negative tests. Of course, further testing will assist us as we seek to ascertain how widespread these cases may be. But testing is not my only request of those who live in this area, or indeed those who live anywhere in Auckland. It is not a coincidence that those in our current outbreak have not been vaccinated. Those who have not had a vaccine in New Zealand are currently in the minority, but they are the vast majority of our cases. That is because the vaccine works, but it's also because the virus is literally finding unvaccinated people. Vaccination makes a difference. It keeps people safe, but it also gives us choices. And this is how stark those choices are. If we had a vaccination rate at 90% or above in either Hamilton or Raglan, it is highly unlikely that we would be here today announcing level 3 restrictions. Instead, we would be able to rely on other tools like contact tracing and much lower level public health measures. But while we are still vaccinating, we have fewer choices in how we react to cases. And so this is a message for the rest of New Zealand. We are doing everything that we can to keep cases confined to Auckland and managing them there. The people of Auckland are sacrificing a lot to do that too. But they are doing that to give everyone else time to be vaccinated. If, in the meantime, the virus moves beyond the Auckland boundary and the places it moves to have low vaccination rates, then today is an example of how we will need to respond. So please, get vaccinated today if you want to avoid level 3 in your community, and we can avoid it in the future.